Hello, and welcome to Breast Cancer Conversations, a podcast brought to you by survivingbreastcancer.org. I am Laura Carfing, breast cancer survivor and founder of survivingbreastcancer.org, a nonprofit organization providing community, education, and resources to empower those diagnosed with breast cancer and their caregivers from day one and beyond. Hello, my friends. Oh my gosh, I love hanging out with you guys once a week and kind of sharing all of these amazing stories and interviews that we've been conducting week after week. So thank you again for joining us. I am joined today with Dr. Stacey Devine. She has been a board-certified family physician since 2000. She loved seeing people and treating diverse conditions, and eventually she became tired of the surface-level disease management. Gosh, I think we can all relate to that. She longed to spend more time with her patients. Yes, we would love more time with our doctors, and to go deeper into the root cause of their illnesses. Oh my gosh, yes, why is this happening? She also wanted to focus on disease prevention and holistic health and wellness. This is so up my alley. This led Dr. Devine to pursue a fellowship and training at the University of Arizona, Andrew Weil Center for Integrative Medicine, and board certification in lifestyle medicine. She has a solo practice in Davidson, North Carolina, and helps people reverse and prevent chronic disease with lifestyle management and more natural treatment options. She has worked with many people diagnosed with breast cancer in her private practice and understands the impact of their treatment on their physical and emotional health. Integrative Oncology and lifestyle medicine have a tremendous impact on their quality of life, and Dr. Devine believes this should be a standard part of survivorship care. I couldn't agree more. But before we dive into today's hot topic, I want to make sure that you guys know about all of the free, amazing resources that we provide at survivingbreastcancer.org. If you don't already subscribe, we have a weekly newsletter that goes out every Monday in English and every Tuesday in Spanish. We also provide a variety of free programs such as yoga, Pilates. We have our Thursday Night Thrivers support group, which supports people. It's peer-to-peer led for all stages of breast cancer and all subtypes, expressive writing, art therapy. Gosh, I think we just also started a new program with Qigong. I mean, there's so much out there for us to get the emotional and physical support and community that we need when going through a breast cancer diagnosis. So hop on over to survivingbreastcancer.org/events for the total lineup. I'm so glad you're here. And you can also connect with us on Instagram at survivingbreastcancer.org, all one word. And I love to meet people personally as well. So feel free to follow me and William at Laura and Will on Instagram, where Will and I post pictures of our day in the life. He was my caregiver. I was diagnosed with breast cancer, and we launched survivingbreastcancer.org and this podcast, Breast Cancer Conversation. So you will get a sneak peek into behind the scenes, everything we love to do, hanging out with our pup Logan, eating really good food, traveling, and just working like a crazy amount of hours. So would love to see you over on Instagram. That's Laura and Will. And yeah, enough about us. Let's dive in and turn things over to Dr. Devine. Welcome to the conversation. Thank you again for joining our podcast, Breast Cancer Conversations today. I am so excited to be joined by Dr. Devine, who's going to be kind of enlightening us on all things regarding alternative medicines, complementary care, integrative oncology, lifestyle medicine, and just even in this intro alone, I know those are not synonyms, right? And that there's a lot of distinction, except that we use the words interchangeably. So I am so excited to dive into today's conversation. Dr. Devine, thank you for joining us. If you would like to share a little bit about maybe where you're calling in from today and a little bit about your background.
Sure. Thank you so much for having me. I really appreciate the time. And this is a passionate topic of mine. So I'm really thankful to be here. So I actually my background is I'm a family physician. That was my initial training. And I actually have my own practice in Charlotte, North Carolina. So I actually got boarded in integrative medicine back in 2017. And that's when I left my traditional family medicine practice. And then after that became boarded in lifestyle medicine as well. So I actually see patients, not just with cancer, but all types of things in my private practice, but really kind of had this secondary interest in breast cancer survivorship that I've just worked with a lot of patients one-on-one. So that's kind of how that has gone into that kind of interest.
Yeah. And how did you segue from just family practice to something more targeted and focused?
Yeah, that's a good question. So I think for a lot of people that do stuff like that, there's usually a personal reason and then there's usually a professional reason as well. So for me personally, I just was having my own kind of health journey and really wanting to learn more about not following in some of the genetic paths that my family was in. So just wanted to really focus more on my own health. And that kind of led to my doing more research about health. Believe it or not, even as a physician, we get a lot of disease training, but not a lot of health training. So that was kind of that led that. And then also just for me, just as a family doctor, I think what I envisioned doing in the day to day really wasn't what I was doing in practice. And I didn't really feel, even though obviously medications can be very helpful, I'm not anti medication, but so there, there was days that I felt like I didn't have time to really connect with people. It was just so fast paced. And I would have somebody like on 7 medications. And I was like, is this really healing? Is this really my goal with that person? And so I really kind of wanted to find another way and to really focus more on that health and wellness side. And obviously have that disease kind of background, but understand how we can use some of these other tools to help people truly get healthier.
I really appreciate that point and that distinction between medicine and health. I think that's the first time I've heard it, but it so resonates because a lot of times when we're going to the doctors, and it wasn't until my own cancer diagnosis that, just growing up, I was a pretty healthy kid, adolescent and everything, never really broken any bones. Like when you have an issue, you go to the doctors, they give you medicine, you get better. Like they were like the fix-it people. And it wasn't until I got breast cancer that I realized it wasn't a perfect science. There was a lot of like retooling of like medicine and the dosage and what's working. And I had to really let go of my like A-type personality of like, oh God, we're changing this again. Like I was on the path. I like committed to the path. And now we're like veering and pivoting. And, when we think about health, you're absolutely right. So there's that, what the oncologist is bringing to the table with the traditional medicines and approach that people are taking. But as patients, I think there's so much more we want to bring and feel like we're being a part of our healing as well. And I think that's where your insights are going to be able to like really help us understand like what is that health that we need to make sure that we're tolerating the medicine while getting at the root cause of some of these symptoms and understanding, how we can really be empowered by that level of control. So
yeah, I think that's it 100%. I mean, the majority of people that come to see me, whether it's breast cancer or other things, most people, that's one of the things they say is they want to have a role and they want to know what they can do. They don't want just the medicine, right? They want that kind of that holistic approach. But sometimes they also say like, is there something I could do to avoid taking this medication?
Yes.
So something like high blood pressure or something like that. They're like, could I be doing something that maybe I don't need this medication? They just kind of threw me on it and didn't really have a discussion with me.
Right.
So that's kind of the other thing that I think is really empowering for people is that there are people that are willing to make changes, but they need guidance on what to do.
Absolutely. And I think the blood pressure medicine example also really resonates because so many of our listeners and members are on medicines that elevate your cholesterol, elevate your blood pressure. And so we're just given statins or other types of drugs to just say, okay, we're not going to treat the cause or the root cause, but then we're going to actually help just mitigate to make sure that your numbers are looking okay. So I'm super excited about this conversation. Let's start from the top. Can you define like what is integrative medicine? I've heard you use also the word like holistic and lifestyle medicine. Can you give us just some quick definitions and how these terms?
So what I will do, because I'm not good with memorizing things. I'm going to actually read you the formal definition because I have it up, but then I'm going to tell you kind of how I say practically what I say to patients.
I appreciate that. Yes.
How I use that. So first, let me just say integrative oncology. We'll talk, because obviously we're talking about for the average patient that has breast cancer. So integrative oncology, the definition is that it's patient-centered, evidence-informed field of cancer care that utilizes mind and body practices, natural products, and or lifestyle modifications from different traditions alongside conventional cancer treatment. So that's the formal definition. How I explain it, both with integrative oncology and even lifestyle medicine, is kind of like we already talked about in the beginning. So I kind of say, your oncologist and your team or your cancer care, they are the specialists in treating your breast cancer. So that is their job. My job is to treat the rest of you. So it's to focus on your mind, body, spirit. It's to focus on how do we improve your health. And things like, reducing inflammation, improving your immune health, but also, again, focusing on this emotional impact of a breast cancer diagnosis, some of the short and long-term complications of your treatment. So we already talked about the heart disease one. That's one that I spend a lot of time educating people about because they're not counseled about that a lot of times in survivorship. So it's those other aspects, but it allows me to have a lot more tools. So obviously we do have conventional medications we can use, but we can also teach patients things about stress reduction techniques, how they can incorporate that. How do we bring in some of these integrative approaches that maybe are not medication based? What other things? And again, that's all evidence based. So what has been studied for this? But it's also looking outside the United States as well. So that's typically, again, that's where I'm trained. So, understanding that maybe something like medicinal mushrooms or something else that's used around the world may have some benefit, but it's not something that maybe is taught as much here in the US. So those types of approaches as well.
Fantastic. So it's like this larger toolkit to
Yes,
treat the whole person.
Exactly.
I love that. Yes, I always say I want as many doctors in my back pocket to be looking at me and then helping me manage everything that we're going through. So the more the merrier. And so along those lines, when would a patient normally come and look to find you or someone in your field for integrative oncology? Is it at the onset of a diagnosis? Is it later on during survivorship? Is there a time frame?
Yeah, that's a great question. So most of the people that work with me are pretty much through their active treatments. Now, that doesn't mean that there's not a role even earlier. I think there could be and there should be. I think the problem is, as most people that are listening probably understand, is that beginning stages, you are so overwhelmed. And there are so many visits going on and so much happening that it's just one more thing. I think a lot of times that people are like, oh my gosh, I can't do one more appointment. I already have too much. So, for a lot of people that come to see me, I think some of that is even just processing kind of the time and what they've been through. But it's also, it's almost like I got to get to the next appointment, got to get to the next treatment. And it's those hurdles that they're going through. Mm-hmm. And then it's typically when those visits, all of a sudden they're like, okay, now I'm not seeing my oncologist for 3 months. That's when a lot of people start, I think, having that questioning of, but what should I be doing now? Right. We're not doing anything for 3 months now.
Yes. Who's watching me? Whose eyes are on me?
Exactly. But I think obviously you've kind of gotten through those hurdles. I think also they're not feeling the way they thought they would at that point. So we still have a lot of those short-term side effects. But then I think, again, some of that, and I think just having that emotional and physical energy to be like, this would be the time that would make sense if I'm going to start making some changes in my life. Mm-hmm. It's hard to do that when someone's going through chemo or they're just not feeling very well. Sometimes it's a little bit harder to have focus on behavior change when you just don't have that capacity to really feel well enough to do it.
Yeah, that's a really great point. And I think too, after getting through kind of this whirlwind of treatment and surgery, depending on your plan, I feel like I almost fell off the examining table when my doctor told me I was going to be on some of these hormonal therapies for 5 to 10 years. I was like, everything was in a week's form or a couple months. And then all of a sudden it was like, wait, I was incredibly healthy before this. And now I have to be taking these pills literally every single day for, X amount of years. And so I think at least in my head, that's when I wanted to reach out to someone like you to say, okay, what should I be doing as a younger woman diagnosed with breast cancer, kind of weighing the risks and benefits of, the prevention of recurrence, but then also dealing with osteoporosis or osteopenia, dealing with the heart disease that we talked about, especially if you had radiation on your left side of your chest. All sorts of things that I'm sure our doctors told us of all of the risks when we were hearing the words, you got cancer, and hear all the risks of treatment. But I think at that point, you're just so focused and laser focused on getting the cancer out of your body that it isn't until really this post-active treatment and survivorship when you're really thinking through the long-term whack-a-mole of everything else that's kind of happening because of the toxicity.
Yeah, it's the collateral damage, unfortunately, and a lot of people don't talk about it, unfortunately, until it's kind of already happening, right? So you kind of talked about, so, then they get the bone scan, they're like, wait a minute, now I do have osteoporosis, and that's a big deal. Or, some of the heart disease risk, same thing. I mean, I have a lot of patients that really weren't counseled a lot about that. And unfortunately, then find that out and they're like, wow, I didn't really know that this was even a potential. It wasn't discussed as much as it probably should have been.
Right. So thinking about, the holistic approach and then integrative oncology, can we dive into some of the like examples that you might be telling or sharing with patients, whether it's like movement and exercise or diet and nutrition? Where do you really start when doing this assessment?
Yes, that's a good question. So when I work with patients one-on-one, I'm blessed in the fact that because I have my own practice, I do a 90-minute new patient visit. So we
Awesome.
have a lot of time to talk about all of those lifestyle behaviors. So I usually have a few things that I like. Again, I kind of look at all of those pieces. So in lifestyle medicine, we kind of have 6 pillars that we talk about
Mm,
of your day-to-day life. So I definitely look at all of those. So, but I'm a very big believer in kind of patient empowerment and for them, obviously, to be involved in some of the decision making as well. So a lot of times I'll kind of say, well, here's some areas that I'm kind of seeing that we may want to discuss. Where do you feel most comfortable starting? So, not everyone may want to start and do everything at once. Sometimes that's not the best strategy when we talk about kind of goal setting and things like that. So, we may start with something like with nutrition, but we may start with like, okay, let's talk about either something specific, like let's make over your breakfast, and like maybe work on 1 meal a day and try to incorporate some things that they feel like they could definitely do, or something like movement. If someone's really not exercising regularly, same thing. We talk about some of those barriers. How could we bring that in? Where would we actually put it into their day? So we don't just kind of say, go exercise, actually troubleshoot some of that, to say like, okay, when would you see yourself doing this? What would we do about, making this safe for you so that if
yes.
you have something like pain or lymphedema or things like that, that we're making sure that we're addressing some of those other side effects.
Yeah, super helpful. I know myself and a lot of our listeners too, we lament about how much weight we gained because of the chemotherapy treatments. I think it's like a misnomer that if you're on chemotherapy, you're going to lose a lot of weight. And while some people do, I think the majority of us, because of the steroids, are gaining weight. And I feel like I was just like this like fluffy cherubim without hair, at the time. But then it was like so hard because I think also of the stress that we're going through, and then you're feeling fatigued, and then your joints hurt and you don't want to exercise. It is this like, as you were mentioning, the collateral damage of like snowballing that it's really hard, even if you had a healthy lifestyle previously, because again, we don't always know why we got cancer. But if you didn't originally like move often, walk, exercise, eat healthy, how much of an uphill battle that is now, even after everything that we've gone through. So I think it's so nice to have guidance and a professional to kind of keep us accountable and then also see us and hear us and understand what we're going through, where, we're not saying go out and run a marathon tomorrow, but maybe it's walking for 20 minutes or getting outside and getting some fresh air.
Yeah. And I mean, I think I have a newsletter that I send out that I say this all the time, that unfortunately a lot of people don't understand that chemotherapy is a significant risk factor for weight gain. And it is statistically, I think it's like 85% of women, with chemotherapy with breast cancer do gain weight. So and unfortunately that can impact again, some of the long-term consequences. So we do want to counsel patients. We want to be sensitive to that and obviously understand this is not shame. This is not blame, and support them and say, like, part of this isn't your fault. Because I think that's the other thing. I've had people kind of come to me in tears that their oncologist was kind of like, well, we kind of saved your life. So sorry that you've gained 20 pounds. Kind of like that was kind of their attitude. And, so again, it wasn't like they were trying to be mean or anything, but they really weren't supporting how that patient was feeling. And like, this is frustrating. Like, I was a healthy person. I haven't changed my diet. And I had one woman that was still exercising and she's like, I've gained 20 pounds. And I'm like, I'm not okay with that.
Right.
And they were just kind of like, well, you just go ahead, go on your way. It'll come off eventually, kind of thing. But she was worried about it because she was not only just not feeling well, but also worried because of the potential impact on recurrence. And so wanted some strategies. Okay, what should I be doing to kind of help counteract some of this? So, we talk through that, but I think again, it's not just a cosmetic issue that we need to focus on. And I think that's the other part, that women need to be supported in this, that there are metabolic changes that are happening because of their treatments that then are causing, unfortunately, some increased risk, but we need to help them. How can we support them? And again, make it not about blame or kind of that, some of the unfortunately bad advice, like calorie in, calorie out, kind of, just eat less kind of thing, eat less, move more. We want to give them a little bit more guidance than that.
Yeah, absolutely. And I know everyone's story and metabolic makeup are unique and different. But do you have some examples, like if you were coaching this person, because I hear this also a lot in our communities, right? Like I gained 20 pounds, I gained 30 pounds, and nothing seems to be working. Where
Mhm.
does someone like that even start?
So I think a couple pieces that I would really focus on. So again, I think with the exercise piece, if it's feasible, I do like to encourage trying to increase the intensity.
Mm,
Sometimes we do need to go a little bit longer, and a lot of women are still afraid to add weight. So again, if we have something like metastasis or bony issues that we have to be careful, obviously, with adding weights or things like that. So again, that needs your doctor's permission. But for a lot of women, we can start adding either resistance training, things like that. I think to protect muscle mass and bone health is really important. And that just helps with that kind of what we call that resting metabolic rate. From the dietary aspect, a lot of people focus more on what they should be pulling out rather than what they
mm,
should be getting in. So I love that kind of focus on really like a nutrient dense diet. So if we're really focusing on increasing fiber rich foods like fruits and vegetables, generally speaking, those are lower calorie anyway, but they have a lot of better nutrients in them because of things like vitamins, minerals, but also things like fiber, which is very important for really kind of maintaining your insulin levels. And
mm,
that's a big piece of sometimes these metabolic shifts is that the impact on insulin in your body. So things like what you're eating and kind of focusing a little bit more on that kind of keeping that insulin level in check, but also things like potentially you're looking at your eating windows. So
mm,
overnight fasting, things like that. It doesn't have to be a super long period of time, but for some women, especially that are still like eating at 9 o'clock at night, just moving it back so that they're stopping eating dinner at a certain time and having at least a 13-hour fast overnight, that can make a big difference in your insulin levels.
hmm. I didn't know that. That is so helpful. And
Yes.
you're absolutely right. Like I was playing around with a lot of different diet options, trying to figure out like what works.
Mhm.
And I think it's also like mental. So I started bringing a bag of like carrots, like the little Ziploc baggies of carrots to work because I found out that I was also like a stress eater, right? Like something
Mhm.
like I would get the email that would pop up on my screen and all of a sudden I'm like, "Oh my God, I need like chocolate or pretzels or chips or like something to just get through the stress of the day, if you will."
Right.
But having like the crunchy, like being able to go into a bag and pull out my carrots like ad nauseum and just like, but have the crunch and like the texture, I think that was like a great substitute for me just to say like, yes, I'm still getting that like oral fixation and that idea of like reaching into a bag of chips, but it just happens to be carrots and kind of getting through my stressful emails. Worked for me. So just kind of trying to find like these little habits to like change. And realizing and asking yourself, also like journaling, I think also was another
Mhm.
technique that I utilized to be like, why am I craving this? Why,
Mhm.
after a stressful day of work, I want to come home and have a glass of wine versus a cup of tea? Or like, what are
Right.
the different things of like really trying to get at the root cause of my emotions and why I'm feeling certain ways? I found to
Mhm.
be incredibly helpful and surprisingly enlightening about things that I didn't
Mhm.
even realize were like bubbling up inside of me until I was like literally scribbling it down in a journal.
Yeah, I think that's wonderful. I think for a lot of people to have that pause, you
Hmm.
know, am I truly hungry or am I feeding something else?
Yeah.
I think that's a big one. But I always counsel people too. I mean, I think some people, unfortunately, we live in a very weight obsessed society, and I think for a lot of people, they expect the pace of weight loss to sometimes be like we are 20 or 30 again, and that sometimes that also can change. And again, I think sometimes some of the treatments what has happened, what we know about is that it can be slower. And so I think that's the other kind of focus I have with patients is like, let's not focus on the number on the scale. Let's focus on your health and creating healthy behaviors. The
Mm.
weight loss will come, but if you're constantly weighing yourself or a little bit too frequently, that just sets up that stress response. And it also just gives you that kind of negative feedback that you're just frustrated and upset. That's not so great for our cortisol and how we feel about ourselves. So, I
Yeah.
really encourage people to focus on the healthy behaviors rather than their weight. And then the weight is it's going to be slower. But I also typically follow people's labs. So I'm usually kind of
Mm.
showing them that, okay, like we are doing these XYZ changes. We're going to recheck some labs in 3 months and they will see that significant change in some of those metabolic markers before they really see as much weight loss as they're hoping for. So I
Sure.
think that's also kind of encouraging. Sometimes that if we're only looking at the weight, it's a lot slower than people want.
It is. It is, especially when you're thrown into like menopause early
Yeah.
or just dealing with, I think, Yeah, I think one doctor too was telling me like, well, you're just getting older. Just to your point earlier, like I saved your life. He was like,
Another one that you really don't want to hear,
right. I was
right?
like,
Well,
okay,
thank
well,
you.
thank
Yes.
you, but I still shouldn't be this heavy anyway. But I think you're
Yeah.
absolutely right. Like there's other indicators of health, and it's not always just on the scale. It could just be like how you're feeling less
Hmm.
fatigued. I love the idea because all of us are getting, blood work done so regularly just to make sure that we're maintaining. And now with the portal that we can all just check our numbers online, like
Hmm.
they spell it out there for you. Like you'll have the high if like something is off the charts, not normal, and then you can actually track your progress over time with like the graphs. And so I do think that's rewarding to see like, okay,
Hmm.
I might not, the scale might tell me one thing, but health wise, I can see that I'm on the right track. I love that idea.
Right. Right.
So we talked a lot about stress. I'd like
Hmm.
to linger on that a little bit more as well, because
Sure.
I mean, of course, people, again, given how society is, we are just always stressed.
Hmm.
And then when you have a cancer diagnosis, how that could just add to, how you're going to take care of your family, your kids, your work, your job, relationships, and then thinking that we're going to just go back to quote unquote normal once this is all done. And all of us are realizing, okay, that's not my normal anymore, and I have to adjust. What are some techniques that you recommend to patients who are dealing with just high levels of stress, and to your point, increased cortisol levels, which will be this kind of cyclical cycle of, being hungry or stressed or putting on weight, that's really hard to like break.
Yeah. So I think for yourself, some of the tools that I love, one is just breathing techniques, which is you can do those all day long. We have to breathe anyway. So that's what I tell people. I'm like, you have to breathe anyway. So let's just do it in a way that kind of helps reset that, the sympathetic nervous drive just kind of calms that down. So Dr. Wild teaches the 4-7-8 breath, which is just inhaling for 4 counts, holding for 7, and then exhaling for 8. And really what you're doing is just you're doing a very long exhalation. And what that does is you're completely emptying the lung. And then what you're going to feel on that next breath cycle is you're able to kind of inhale much more deeply. We're using our whole lung when we do that. And what that does is it hits the vagal nerve, which in the diaphragm sends a message to your brain like, hey, everything's okay. And you can feel it in your body, that you'll just kind of start feeling that relaxation, like your muscles will tend to, if you kind of feel like you're kind of tense, that will help. I'm also a big believer in basically it's mindfulness, but mindfulness based stress reduction training. So that MBSR, there are some online programs for that. There's one that's even, I think, free still, for people to learn more about that. So I took the class myself. I thought it was great. So for someone that's new to it and wants to kind of understand more about, like, if you're like a geek like me, I love learning how things work. So understanding how it really does affect our neurochemistry and kind of really how it actually impacts our brain directly, but even then practical tools. So learning how to do it, learning what meditation actually means. Cause I have some anxiety. I definitely, the first time I tried to do it by myself, I was like, I pictured like, somebody sitting on the mountaintop, like with like, their brain is just completely empty. And I was like, this is never going to work for me ever. Like I am just like, the thoughts are crazy. And, but learning that it really wasn't that. It wasn't the expectation that my brain will be quiet. It was more that I have the choice to decide that those thoughts are things that I want to engage with or not. So really that the practice of that can be very empowering, because obviously the fear of recurrence for a lot of people, that's something that we want to kind of train ourselves to kind of like, okay, is this a spiral that I want to go down right now? Or is this a thought pattern that I want to say, like, let's not go there. Let's focus more on, the healthy parts of my life, the things that I can control, rather than the future, which I cannot. So
Yes. No, I love that. And as you were speaking, I was thinking also like, while it may not seem like we always have a choice, we
mhm,
actually really do have a choice. And even not making decisions is a choice in and of itself. And so I really
right.
feel like with those flooding thoughts that we get into our minds, or just the way we react to situations, I think is something that I'm really learning to hone in on and just say,
Mhm,
what is this serving me? Is this how I want to be? And I think especially after a life-threatening diagnosis, I think a lot of us too have a new appreciation for what's important to us and how we want
mhm,
to live. And so I think that's like the mindfulness techniques, the breathing techniques,
mhm.
are really helpful. On a funny
Yeah.
note, I have to say, once I returned back to work after all of my treatments and everything, and I resonate with what you were saying, where every pain, every cough, every sneeze, I was like, oh my gosh, it metastasized, it came back, something's wrong with me. And I remember the
Mhm.
first time I got like frustrated that the printer got jammed and like I couldn't get my document out, and I remember being so happy in that moment that I got frustrated at something so small, like the printer being messed up, that I was like, okay, I'm slowly feeling back to normal, back to myself, where like I'm not just always thinking about cancer, but yes, I can be upset at like technology. And so I just think that was like a funny like light bulb moment of, okay, like we could be frustrated in benign things. So
yeah. And then I think the other stress reliever that I'm a big believer. So with lifestyle medicine, we also talk about one of the other pillars is social connection. So I think also just making sure that you have that support network. I think that's just incredibly helpful for stress, just to have people that you can talk to, that you can, again, share your feelings with. I think that's critically important. And I also think just getting out in nature, that's something that I like to do, like actually with a friend. So it's like walk with a friend outside. You do a lot in that. You're exercising, you're connecting, but also I think that time in nature is also super therapeutic for kind of our stress levels.
I totally agree. Do you have like a favorite nature spot? Are you like an ocean, water, or mountain person?
Oh, I wish I could. I'm like about 3 hours from the ocean. So that would be my favorite, but I don't live there. So that wouldn't be super practical, but I do love water. So there's actually in our neighborhood, there is a pond, and strategically that's in our walk because I love to just see that water, and we see the little ducks, and it's just very pretty and calming. But yeah, if I could, I'd be walking on the beach.
Yes. Oh, so lovely. Excellent. And so tell me a little bit about the Thriving After Breast Cancer. You said that you developed this course that people can engage with.
Yeah. So I've always loved the theory of group visits. That was actually something even in family medicine I thought would be great, because same thing with the pace of medicine. Sometimes you find yourself like, okay, I wish I could just get a bunch of these people together and talk to them in a room, and I'd have more time to talk to them. And so in my own practice, I actually had a couple little classes that I was teaching on different things. But then you kind of come into I can't make it Thursday at 4, people that want to come. And so to do live things sometimes is even a challenge. So after I was working with one-on-one kind of breast cancer survivors, I kept seeing like, okay, there's a lot of education that's missing here across the board. And I have a lot to talk about with this. Same thing, it's not really feasible to spend 5 hours with an individual patient. So my thought was, I'm going to package this into an online program. So incorporated a lot of this stuff. And so it's kind of self-paced so that, again, we want to meet people where they are. Some people obviously are just kind of want the baby steps. Some people are a little bit more, consider themselves advanced. They really want some of the more kind of higher level things. So I just wanted to basically have that information in a place where people could, again, access it whenever is convenient for them. Because again, I know how busy and obviously the pace that people have. So that's kind of what I did. I kind of packaged it into a course.
Amazing. And so because it's online, anyone across the globe basically could access it.
Yeah. So that's the cool thing, is that actually initially started in more just US, but I definitely have some international students now, which is very cool. So that's kind of been really kind of exciting to see where people are learning from. So
absolutely.
Very, very cool.
So where could our listeners go to find out more about your course or to connect the website or a place to get more information?
Sure. So my that online is kind of an online business just for breast cancer survivors. You can go to my website, which is Thriving ABC. So that stands for Thriving After Breast Cancer, Thriving ABC. And there's some free resources on there. I actually have a free video training that people can learn more about the role of integrative medicine and lifestyle medicine for breast cancer survivorship specifically. I talk a lot more about the breast cancer survivorship guidelines and how we can use this to kind of really hopefully help complete people's care that they're getting from their oncology team. And then you follow me on Instagram at Stacey Devine MD. Most of my online content really is geared more for breast cancer survivorship. And then I also have a Facebook page that is Thriving After Breast Cancer with Stacey Devine MD. So
awesome.
It's a long one, but yeah, that's there too.
Excellent. Well, we'll definitely be able to, put that all in the show notes and make sure that everyone can find and access you. I'm going to definitely check out your Instagram. That sounds super helpful. So I really appreciate this. And, one thing that, we're always about trying to get information out to our patients so they feel empowered and that they know what type of questions to ask. And we have, and maybe this is something we can partner on in the future as I'm just brainstorming. We have questions to ask your surgeon or questions to ask your oncologist or radiologist, but we don't have a handout or anything to say questions to ask your integrative oncologist or, lifestyle medicine coach. So I would love to ask, like, if someone is going out trying to find someone like you and they're not in North Carolina, like what are the things they should be looking for? Is there like a society or an organization with reputable like doctors that we should be looking for? Or
I typically tell people you want to go probably to the professional organizations. Most of them do have a tool where you can find providers that have been trained. So the American College of Lifestyle Medicine would be for lifestyle medicine specifically. For integrative oncology, there is a Society of Integrative Oncology. So it's called SIO. They have a website. And then where I was trained, which the integrative, basically it's the Andrew Weil Center for Integrative Medicine. It is a 2-year fellowship program. They also have an alumni finder on there. So to see if there is somebody that's in your area that's been trained. But I'd also tell people, you may want to check with your kind of the biggest cancer center in your state. A lot of times they do have an integrative oncology department. That's usually, they're going to be at bigger cancer centers. They're typically not a lot of times in the more community centers. But a lot of times that's where some of those people are, or there may be departments. Now they may not offer all the services, but they may offer certain things. And so again, I think it's worth checking out what's available to you locally.
Yeah, a place to start. I love that. That's wonderful. In terms of kind of, we talked about so many topics. Is there anything that I haven't asked you or things that you would like to share with our listeners regarding, I guess, the broad spectrum of your work and life after cancer?
Yeah, I think my one thing would be to make sure that people understand that just because you might, again, a lot of these women may be on hormone blockers or just kind of, again, those visits kind of really space out, that doesn't mean that there's nothing left. And I think a lot of them are just, they're not feeling great. And they kind of feel like, well, that's kind of it, like this is all they offered. And now I'm kind of like, this is how my life has to be. Right. I've had a lot of patients that came to me that were having chronic pain, or again, some of the weight changes, or just, been on a lot of medications that they were not happy that they were put on, told that they were depressed when they really, really just weren't. So, there's a lot of things that we can do with integrative oncology and lifestyle medicine to get people feeling better. Now, these are not like the quick fixes that, again, that you just Band-Aid somebody. Sometimes, obviously, the role is that you're going to probably have to make some changes too. But there's definitely hope that things can get better. Yes. And I've definitely seen that with the patients that I've worked with. And even some of the women that have taken my course, they'll send me messages like 6 months later and say, this is incredible. Like, I didn't know it was possible again for me to feel this well again. And just to not give up, and to hopefully, that there are some resources out there. Sadly, there just aren't a lot of people trained in integrative medicine and lifestyle medicine. So that's still kind of both of those are kind of, we just don't have enough providers. And I think that's what may be a struggle as well, is sometimes it can be hard to find somebody that has this level of training and can kind of give you this information. But thankfully, there are more and more kind of online resources if you don't have someone local that you can get some information to hopefully help you through this time.
Amazing. Wonderful. Well, Dr. Devine, I really appreciate this conversation. So rich in content, and I'm motivated. I think I'm going to go for a walk this afternoon and just maybe pick up the pace a little bit myself. And so this is wonderful. I really appreciate you taking the time to be with us today.
Well, thank you so much for having me. I really appreciate our time together.
Likewise. And thank you, everyone, for listening to our show. I would like to acknowledge that all of the information on our podcast are from personal experiences and are not a substitute for professional medical advice. You should always contact your medical care team. If you're looking for specific topics or would like to be a guest on our show, please feel free to reach out to me. My email is laura@survivingbreastcancer.org. Until next time, keep on thriving.